In this session, I shall be discussing on one of the important hematologic lesion, that is Hodgkin lymphoma. So what is the classic morphology of a Hodgkin lymphoma? The key is to identify the background inflammatory cells. As you can see here, there are a lot of inflammatory cells, predominantly lymphocytes, and here and there you can see some eosinophils, which again gives you a clue, very important clue with respect to Hodgkin lymphoma. And in between you are seeing a Reed-Sternberg cell saying hi to you, right? So these are the neoplastic cells. You can see that they have got a prominent nucleoli and here they are sitting in an empty space. This is actually a lacunar cell, okay? So the presence of inflammatory background, which is at times rich in eosinophils. Other inflammatory cells are lymphocytes, plasma cells, histiocytes, all of them can be present, and in between you have a classical Reed-Sternberg cell and sometimes a mononuclear, which is called as a Hodgkin cell, sometimes a multilobated cell, which is known as a popcorn cell. So all those can be present depending on which variant we are looking at. Now, what are the important variants of Reed-Sternberg cell and where do you get them? So, this is basically a classic type and this is the mononuclear type. These two are usually associated with mixed cellularity, Hodgkin lymphoma, or they can be present in lymphocyte rich or lymphocyte depleted type of Hodgkin lymphoma, right? Now moving on to the other variant, this is a lacunar variant. You can see that there is a prominent nucleus and then you have an empty space. It appears as though these cells are sitting, the nucleus is sitting in an empty space. These are nothing but lacunar variant of RS cells and they are characteristically associated with nodular sclerosis type of Hodgkin lymphoma. Remember this. Now moving on to some other types. In some of the RS cells, there can be multilobated nuclei like this, similar to a popcorn. So these cells are called as popcorn cells. And sometimes the nuclei shrunken. These are called as the mummified cells. Sometimes there are multiple nuclei with prominent nucleoli, okay. So these are actually the giant cell form or the multinucleate forms. So where do you see them? This particular type, that is multinucleate form as well as mummified form, is seen in case of lymphocyte depleted type. Whereas these popcorn cells, which are also called as LH type, okay, they are associated with nodular lymphocyte predominant Hodgkin lymphoma, that is non-classical Hodgkin lymphoma. Remember this, okay. These are the important subtypes and where do you see them. Now, important features of different subtypes have been compared. So, the frequency, which is most common, remember that the nodular sclerosis is the most common subtype among the Hodgkin lymphoma. In India, it is said that probably the mixed cellularity is the most common subtype in India, right. The lymphocyte depleted variant is associated with HIV infection, right. The association with EBV, you remember that nodular sclerosis has no association. Nodular lymphocyte predominant also has no association with Epstein-Barr virus infection, whereas highest association is found in lymphocyte depleted type and to some extent in case of lymphocyte rich and mixed cellularity type. Clear? Now, with respect to gender and age, okay, remember that there is equal predilection with respect to sex in nodular sclerosis. In all other variants, the men are more commonly affected when compared to that of females, right. With respect to age, the nodular sclerosis and nodular lymphocyte predominant occurs in the younger age group, whereas the mixed cellularity, lymphocyte rich and lymphocyte depleted occurs in the older individuals. The type of RS cell. So now you should be very alert, right? What do you see in nodular sclerosis? It is the lacunar variant. It's more common. Whereas in mixed cellularity, you will see classical RS cells as well as Hodgkin cells, which are called as mononuclear cells. Now, in case of lymphocyte rich, as the name implies, the inflammatory cell would be predominantly lymphocytes, and in between you will again see the classical RS as well as Hodgkin cell. Whereas in case of lymphocyte depleted type, most important, you need to remember this. Here you will see multinucleate forms of RS cells as well as the mummified forms. Okay, remember this, mummified and multinucleate forms. Whereas in case of nodular lymphocyte predominant, you will see popcorn cells or LH cells. Now moving on to IHC. So as I already mentioned, these would show, that is nodular sclerosis, mixed cellularity, lymphocyte rich, lymphocyte dominant. Till here, okay, the markers of Reed-Sternberg cell would be CD15, CD30 and PAX5 for all this. Okay. Whereas for nodular lymphocyte predominant Hodgkin lymphoma, it is CD20 and BCL6. Moving on to prognosis, which is the subtype under classical which has got the best prognosis, it is nodular sclerosis. Under non-classical, it is nodular lymphocyte predominant, even that has got best prognosis. The worst prognosis is seen in case of lymphocyte depleted type, whereas in between you can expect for mixed cellularity and lymphocyte rich type. So if you remember this table, most of your job related to Hodgkin lymphoma is over, right? So you need to be aware of different variants and their variations with respect to morphology, then incidence, gender predilection, prognosis, etc.